afternoon, good morning, good evening, whatever time you're watching this show. And I'd like to say this is Senior Issues, etc. I'm your host, Vita Verdon, and this is our first show of 2013. Yay! We've made it into a new year. And we're happy that we're here, and we've got some really good programs going for us this year. We're going through a lot of changes, and we are on the growth side. We are growing this year. There's a lot of things in the future I'm going to tell you about. We're just merging into it. I can't tell you everything at this point. But for our first show this year, you know how I listen to all your calls and your emails and your letters that you've mailed me. And this show is for you, and I try to pay attention to what you want to see. So in the process of paying attention, what we try to do is cover the whole body from head to toe. And for today's show, what we're going to be covering, and through one of the crew members here, Joe Pazalagua, that's Pass the Water, he suggested, he said, oh, you got to use my dentist. He's the greatest. He's number one. So I take advice of the people around me. They know what they're talking about. So I am bringing out the greatest dentist of the area as the advice of one of my crew members. And we're filming here in Libertyville, Illinois, and he is a Libertyville, Illinois. That's about 30-some miles outside of Chicago. He is a local Libertyville dentist. He also has a couple antique cars that we'll ask him a few questions about. And his name is Dr. Stuart Schwartz. Oh, doctor, it's so good to have
Likewise.
You here today. Now, I've gotten to know this audience out there. We've become like family, and they tell me what they want to hear. And they like to hear a little something about you, before they like to hear what you have to say. They want to know a little something about you. So why don't you tell us a little something about yourself, where you came from? Are you married? Do you have any children? Do you have any grandchildren? So tell us a little bit about yourself.
Well, my name is Stuart Schwartz. I've been practicing in Libertyville for 40 years. I graduated from the University of Illinois in Chicago in 1970. I went into the Army for a couple of years and then came out and went into practice in Libertyville. I've been in the same office since. I've been married for 44 years to my wife, Ellen, and I have 2 children, David and Leslie, who are adult, and I have 1 grandchild.
Now, what I want you to do is give her a big smooch, especially from Grandpa.
Papa.
Oh, Papa, okay.
Oh, yeah. Hi, Macy. Mwah.
Give her another one.
Mwah.
Yeah, let her know. Hey, Macy, this one he's doing for you. You're the apple of your Papa's eyes. Okay.
She certainly is.
So,
I was brought up on the north side of Chicago in the Albany Park neighborhood.
I know Albany Park, because I was born at 31 North Logan Square.
All my parents were from there. My mother was from there.
Uh-huh.
But I went to Roosevelt High School.
I went to Carl Schurz.
That's where my mom went.
Uh-huh.
In University of Illinois, first at Navy Pier, and then they moved to the Circle. I got my bachelor's degree there before dental school. So
And
my
then-
whole life has been Chicago.
When did you move out to the suburbs then?
When I got out of the service in '72, we lived in Skokie for 3 years.
Uh-huh.
And I commuted out to Libertyville for 2 years.
Uh-huh.
But that's when traffic was not such a issue as it is today. And then I moved to Vernon Hills in '75 and lived there.
Now, when you started out as a dentist, you didn't have your own practice, did you?
For a year, I went into practice with an older dentist. And then I came out here in '73 for my own practice.
That's what my brother did. My brother actually had a practice in Grays Lake, Dr. Alex DiStefano, and we had a childhood dentist who had moved out to Grays Lake and started it. And then when my brother was in the service as dentist, he contacted my brother because he had a heart attack. So he went in with older dentists, and then he took over.
Well, I knew your brother, and his partner was one of my instructors in dental school.
Oh, uh-huh. So
Been a while.
dentistry is very important. You know, what I'd like us to talk about, have a little conversation about, is actually tell us a little bit, what is dentistry? Break it down in you know, like senior language.
Well, dentistry isn't just teeth, but it's the care of the mouth. It means the teeth, it means the support structure, in other words, the periodontium, and any other lesions there might be in the mouth, the cheeks, the tongue.
What you say, the support structure, the periodontia, what does that mean?
Well, the periodontia is made up of several parts. The outer covering is the gums that we all see. And then there's bone inside the gums. And then there has to be something going from the bone to the teeth. And that's called the periodontal ligament. The bone isn't fused right to the teeth. There's a little membrane in between them.
And what is that membrane?
Periodontal ligament.
A ligament.
Or PDL.
And so that has to be maintained.
Oh,
right?
yes. Without that, it'd be like building a house in quicksand.
Oh, so that's
won't
like
work.
the foundation.
Exactly.
That's like the foundation in a building.
Correct, right.
So we have to start with the maintenance of our foundation.
Right, if you don't do that, the teeth will be in your hand.
Oh.
When I was a dental student, the first time when I was in an oral surgery clinic, we just assisted a senior dental student. And the very first patient we saw had every tooth in his mouth, he never had a cavity, never had a filling, and he was losing all of his teeth because there was no bone left around them, and they were all loose and wiggling
And what
around.
was the cause of that then?
Probably lack of care. His teeth didn't bother him. He never had them cleaned.
Oh.
So he was just using pain as a criteria. And
So actually what happened? There was deterioration in this ligament?
right, well, when the ligament tries to get away from inflammation, it recedes. And when it does, the bone recedes too. So instead of the bone going around the root like a socket, it's flat like this tabletop, and the teeth are just sitting on it.
So the teeth
At its
have no
worst.
support.
Right.
So actually what did they do?
He had to lose all of his teeth, and in those days, implants weren't used. Nowadays, that would be the first choice. But we didn't follow him through. I was just assisting in the oral surgery clinic, so I don't know what the final treatment was. But in those days, it was probably full dentures.
So that's interesting. So now, for what reason did you choose going into dentistry?
Well, I've always been technically orientated and science orientated, so I was
So
on
you
that
liked
path anyway.
As a boy, you enjoyed science, right?
Right. Languages were lost. And I like mechanical things and working with my hands, so it all came together.
So you actually, it probably was tough, but you actually enjoyed going through dental school.
Right.
Enjoy seeing how it worked.
There was no history in the family of it, but now I have cousins and cousins' children that are dentists.
So you've sort of set a precedent within your own family system,
Well,
right?
I don't know if I was the cause, but I was the first.
Well, you were an influence if you were the first. It's something to break through as the first. So then your first job in dentistry, that was after you got out of the service or before?
Well, the service was my first job, so to speak. And then when I got out of the service, I was going into practice with an older dentist in the Logan Square area.
Now, when you went into service as a dentist, that's what my brother did also.
Correct. I was in the Army.
You probably saw a wide range of things, right?
Right. I was at Fort Sill, Oklahoma for the first year, but in the second year, I was in Vietnam at China Beach, and we just did dental work, but you didn't have specialists and things, so we had quite a cross-section of things to do. We had to do it all ourselves.
As a young person and being thrust into that and into a different culture, that's probably a shock to your system. You probably had to learn as you went, huh?
To a degree, sure, but we all had different experiences that could help the others. Nobody had the whole package, but we all had part of it.
And so you had to like coordinate, share your, because it was on the job training, right?
Right, we had to do it. They were dependent on us. And then there were the cultural differences of just being in Vietnam was different. I was in Chicago all my life.
Uh-huh. And so that wasn't an easy thing to adjust to.
Well, fortunately, we were young.
So it ultimately made a thorough dentist out of you.
Well, contributed, sure.
Contributed greatly if you would go through that kind of shock package.
Did a lot more oral surgery than I ever would have done in the States.
And you didn't have to have like somebody breathing over your neck. You just had to do it.
Oh, there was nobody there to do it.
Right. That is something. Well, that advanced you then to, then after that, after you came back, then you went and had the job with the older dentists, right?
Right. And then I went out on my own after a year.
Oh, that was in the Logan Square area?
Right,
And
right
you
near
worked-
Milwaukee Avenue, and I'm still on Milwaukee Avenue, just 30 miles out.
Oh, what was your first place? Milwaukee and what?
Kimball.
Oh, I know Milwaukee and
And
Kimball.
I think Diversity also.
Oh, yeah. Because on one corner there used to be a Schaefer's Bakery, and there used to be a Wiebold store in there. I know they're long gone.
I think there was a Goldblatt's
A
also.
Goldblatt store also, and a Logan department store. There was a big Logan's, because I was born and raised at 31 North Troy Street. Well, we're going to come back to it and get into the problems in dentistry, but first what I have to go into is what I call my pearls of wisdom. So now, on Vita's Pearls of Wisdom, the first thing I have to announce is one of our cherished, our long-lasting, who is on our board of directors, Selby Hussey, has passed on. And I'm going to do a memorial show on him. He was the director, and he started with us, and he was the treasurer on our board of directors, and he died on New Year's Day with his daughters holding his hand, and his son came in from North Carolina, his son Scott. And he had an easy passing, just like he went to C3. He had several problems, and he was 89. He would have been 90 on the 23rd of June, and he contributed so much to the show. Before we became certified, as I say, he was the treasurer. I'm the president of our non-for-profit charitable production company, and Gloria Shapiro is the vice president, and Selby was the treasurer. And before we got certified, being that we volunteered, and this show kind of fell in our lap, and who knew after 13 years we were going to still be ongoing, which we are, which we're grateful and we thank God for, but we had never filled out all the forms to receive our non-for-profit status. And Selby, who was a medical supply salesman, and he was a perfect English gentleman. He was born and raised in England, and he was a pilot. He had his own plane. And when he came to this country, he became a salesman for a medical supply. So he had a lot of experience. And what he had, when we started the show, he was the only one that really had a computer. And he was the only one with the computer that he could write the narrative for the show. So we wrote the narrative, and we did all the jobs that we were supposed to do, but he was the only one that could polish it out. Since then, I have gained a computer, and since then, we have learned how to do it, but we're very grateful to Selby that he did all these things for us, and our hats go on. This one for you, Selby. You contributed greatly to the show going on, and you will be ever cherished in our memory. Now getting back to the theme of the show, and in the theme of the show, maintenance is really good. Now I have a plate and a bridge, and what I do, and Dr. Schwartz is going to talk about this a little bit. It's good not to keep them in all the time, so I take them out at night and I put them in a glass with those bubbling tablets, and he's going to talk a little bit about that, how to maintain it. and he's going to talk about the cleaning agents and different aspects in the maintenance, because we need our mouth, and we're the only generation that's lived this long, and we have to learn all the ways how to maintain ourselves, because we're role models for the generation following us. So we're going to get back to Dr. Schwartz right now, and I think that you could add to what I said about the maintenance of it, because we talked earlier, and you did mention that they do have certain solutions that you could brush your...
Right, they make toothpaste especially for dentures because they're a little different than enamel. And it is a good idea to brush. The various tablets, though, are real good for getting in between all the little ins and outs and crevices and grooves that are in teeth, whether they're real or not.
And getting the germs out.
Right.
Well, how about any kind of mouthwash? Now, is that necessary? I do it. I do it all the time.
You can get along without it, but they do make your mouth feel much better and fresher. And especially with dentures with saliva, just sitting inside the denture, it can probably pick up more odors than natural teeth.
Yeah. Let's, I think we should start off with what are some of the most pronounced things that happen in the mouth, like diseases?
Well, it might be better to first see the natural situation.
Okay,
and go
let's
on.
do that. All right.
Okay,
That's a good idea.
This is a cross section of a tooth and the gums. This happens to be a molar. And the layers are, you have enamel on the outside, which is hard and calcified. You have dentin, which is hard and calcified. And then you have the nerve inside. And this is the bone. And going from the tooth to the bone are these little ligaments. We all know about the gums and the bone and the roots and stuff, but we don't know about the periodontal ligament, and that is this little thin ligament that goes all the way around the root and supports the tooth in the bone. Now, if we let plaque start to collect around the tooth and in between and under the roots, it causes inflammation of the gums. And the gums don't like that. They try to get away from the inflammatory agent.
So what do?
They start to recede. And as they recede, the connection moves down the root, and these fibers are no longer going from the bone to the root, so the bone starts to resorb. That's where the term long in the tooth came about. With periodontal disease, the bones shrink up.
So
and
the teeth actually don't have that much support then?
Right, and they can actually loosen. You could wiggle them with your fingers at the worst, and they're really not functional and a source for infection.
Well, what is the best course to prevent this periodontal disease?
First of all, of course, routine home care, brushing, flossing, and then getting your teeth cleaned periodically. For most people, twice a year is enough. These soft plaque deposits can become calcified, and you couldn't possibly get them off yourself. The dentist or dental hygienist has to clean them off the roots.
When you say calcified, does that mean they get real hard?
Yes.
They get real hard, so it like even brushing won't take them off?
No, they have to be scraped off with a sharp instrument by somebody that's trained to do it.
And if, say, a person didn't do that, what is the results?
The gums start to shrink up. The roots are not getting as much support, and then the teeth loosen and become unusable. But the other thing to remember is they also become a source of infection. And your mouth isn't separate from your body. It's part of the unit, and it'll go to your body.
So then the thing of it is proper maintenance.
Correct. Prevention is always better than repairing it later.
Right. So now what's the next thing that we're going to go to? Like what happens, well, the next stage would be the person losing them.
Correct, and that's when you might end up with a partial or a full denture.
Well, let's go into that then.
Well, if the teeth don't have good support, they can't help hold anything else in, and that's when you go to a full denture. If some of the teeth have enough support, then you can go to a partial denture. And a partial denture has little clips that would hold the partial in place.
Now, are we talking about the upper or the lower? Because I think there's big differences here.
It could be, either one can be used on the upper or the lower, but the upper is much easier to support a full denture because you have suction. You never have suction on lower dentures, and so they want to spring up. They don't want to stay down. So if you can have a partial.
Now, what I happen to have is a bridge on my lower. And so what I have to maintain is the 5 teeth that I have that
Very
are
much
holding
so.
that bridge in. If I would lose those, I would require a
Full denture.
a full denture on the bottom. And I've been told by my brother, who's a retired dentist, that that's more difficult to maintain than a bridge.
Very much so. Much more bothersome. You know, the floor of your mouth is always moving around because there are just muscles supporting the tongue, and they want to lift up on the denture.
Now, one thing I wanted to mention, I know you had mentioned it earlier, I don't know if we mentioned it on the air, that it's really important to take your dentures out at night.
Right.
What's the reason for that?
Your gums aren't made to have something sitting on them 24/7. And if somebody keeps their denture in night and day, quite often you can make an outline on the gum where the denture sits, and all that tissue can be more red than the rest of the gum. And gums are supposed to be pink whether they have teeth or not.
So the more red, is that a type of inflammation? Would you
Correct,
call that
exactly.
inflammation?
Exactly.
And that could lead to periodontia disease?
Well, the teeth are already gone, so you don't get periodontal disease once the teeth are gone, but it's never good to have inflammation active in your body.
Okay, well, on the tooth replacement, there's another alternative that I hear people talking about. You want to talk about that? They have implants, right?
Well, implants have developed during the time of my career, and it's really
Because now I'm 80 years old, and you know, when I was younger, they never talked of implants.
well, when I was graduating from dental school, they were just starting to do them, and the technique was entirely different than we use today, and it was very unsuccessful. So we all poo-pooed them.
Unsuccessful, you mean that they didn't stay
Didn't
in?
last, right?
Oh, they didn't last.
And so they didn't gain popularity until quite a few years ago now, but maybe in the 90s, 80s. You don't have a ligament going between an implant and the bone like you do natural teeth. The bone has to fuse to the implant directly, and if it doesn't, the implant will loosen. But now we have very few failures.
What is the reason for it being successful now?
Well, the techniques have changed mightily. They found out that in making the hole for the implant, you couldn't elevate the temperature of the bone more than 10 degrees Fahrenheit, which is not very much. So they use drills with water going through the tip and things like that. They have to do it very slowly.
Well, I understand now, this is just what I've heard, that people could go in one day, they have the whole procedure done.
Some do. It's not gained universal popularity yet. It's more common to wait a few months. On a lower, if you're going to wait, they usually wait 3 or 4 months, and on the upper 6, because the bone on the upper isn't as dense as it is on the lower.
But, you know, another area that I'd like us to talk about, I feel that it has some importance that I'd like to have it mentioned, is nutrition plays a part in maintenance of your mouth, doesn't it?
Oh, very much so. First of all, maintaining the gums, because if you don't do that, you don't have support. And we all know the rest of our body is healthier if we have a good diet, and the mouth is just part of the body. It's not a separate entity. And then we've known for all of our lives about sugars and cavities, that's another issue. So you have to maintain both.
And so it is, the mouth is not disconnected from the rest of the body. It's
Right.
all internally connected.
Right, that's why you want to not have any infection or inflammation going in the mouth, because who knows where it will spread.
Well, now, Doctor, Joe has voted you, and we're voting you, one of the best doctors, dental doctors in America. What advice would you give to our senior audience to maintain what they have?
Well, that's it. Maintain. Do the things in home care that you can control yourself.
So that would be like flossing and diet.
Brushing and diet, sure.
And if you have dentures, take them out.
Correct.
And visiting.
Right. A lot of times people think of going to the dentist for a checkup. It's just being a cleaning. But the checkup is just as important as the cleaning. They're both important. The cleaning will help inflammation, and the checkup catch things when they're still at a small correctable stage, not after it's unfixable.
Well, like one of the things we talked about earlier is not to diagnose themselves.
Correct. I can't see inside my own mouth, and I sort of know what's going on. For a layperson, what they interpret may not be correct. They're not a dentist.
Well, one of the things I've asked every guest so far is, what kind of gratification do you get out of being a dentist?
Well, first of all, it's great to fix a problem.
Yes, that is.
Any problem.
Solving a problem.
And it's nice to treat people. And it's definitely nice to be with people all day long. And then I've always been kind of mechanically inclined and like using my hands. And so it all kind of goes together. And as a student, I was always more of a science type person.
So as the last thing, you know what I wanted the last thing to be? I want you to send another kiss to Macy, because she's going to scream again. Go
Hi,
ahead.
Macy. Mwah.
And I'm going to do one too. That's for you, Macy. And you know what time it is? When you come to the end of your rope, you know what you do? You tie a knot and hang on. You know why? Because the best is yet to come. And what we want you all to do this week is catch the spirit. God bless you. We love you. Good
That
show.
was fun.